Hey guys, I'm sure you know someone's a rotator cuff injury, but you probably ask yourself, what exactly is a rotator cuff? The rotator cuff is a group of muscles and tendons that keep the shoulder attached to the body and allows it to move in its natural range of motion. This is important because the shoulder is what we call a shallow joint. The hip is a deep joint, meaning the bone goes into the socket and it's pretty tight in there. But in the shoulder, it's pretty shallow, and this allows it to move in a greater range of motion. So those rotator cuff muscles help anchor the shoulder so it can move without dislocating. How do you injure rotator cuff? Usually through repetitive motion. People who work overhead, like painters or carpenters, do the motion so often they can injure the rotator cuff. But you also see it in people who do sports. Athletes that swim or those who throw, like baseball players, often have rotator cuff injuries. The symptoms of rotator cuff injury usually start very minor. It can be just a little small ache in the shoulder. We take a little bit of aspirin and it goes away. But as the symptoms progress, the pain can become more severe and even cause pain when you're trying to sleep at night. So now that we know a little bit more about rotator cuff injuries and their symptoms, stick around. I'm going to teach you how we evaluate for it in our office, how we treat it in our office, that you can do at home to help your rotator cuff injury improve a little bit faster.